Primary care offers an often untapped opportunity for HIV screening. Many CHCs provide a health care home for those who traditionally have used emergency rooms for their health care. Primary care providers encourage everyone to obtain routine and preventive health care. This should include HIV testing. The CDC has recommended routine HIV testing in community health centers since 2006, and yet few primary care providers in the U.S. include HIV screening as part of routine care. The American Medical Association ethics policy states that a physician's duty to promote patient welfare and to improve the public's health are fostered by routinely testing their adult patients for HIV.
Our folks are coming to us to establish a relationship or to continue to have a relationship as a healthcare home. So they're really looking for us to be their medical expert on an ongoing basis. It's really the beauty of what community health centers now mean to this whole healthcare discussion. It's for folks who really found themselves unable to access good quality care and that used the emergency departments for their healthcare home, now start to understand that there is a community health center many times in their community with quality providers and an organization that they can look at and view as their healthcare home. I think you're going to save money, and I think you're going to save lives. I mean, and again, it's not just about detecting the virus for you, but it's about now making you aware of what that means, not just for yourself, but for any partners or potential partners, your spouse, any potential spouse. That really is a core piece of this also. And that's why the education piece is so critical in the discussions that providers have to have with patients as part of the discussion.
Sometimes nurses and doctors and other healthcare providers forget how much their patients rely on them to tell them important things about their health. That patient is waiting for you to bring up this issue. And the thing is, we don't have to be an expert to do it. The longer the HIV infection stays undiagnosed, the less opportunity that individual has to change their behavior, decrease exposure to other persons, and to receive treatment that also reduces the chance that that infection will be passed on to others. And the longer that infection stays undiagnosed, the more impact it's going to have on this person's health. If you don't do it, you're letting someone leave your office with an undiagnosed HIV infection. We just have to think about it in the long run, which is worse. Many people are concerned that they don't have the training to do HIV testing or to do the counseling that's associated with it. But we'll be clear about this. There's no special training that's required to do the HIV testing or deliver the results.
It's just like getting your cholesterol screened or looking at your blood pressure, all of your vital signs. We want to make sure HIV is included with that conversation. So it makes it very normal.
We still struggle with getting people to test. Making HIV testing the fifth vital sign so it's part of comprehensive care remains the goal.
It's a matter of changing the culture within our staff, normalizing it for people, having them be comfortable with asking it.
Texas is a leader nationally in terms of promoting routine HIV testing in healthcare settings. Opt-out testing is where the clinician simply informs the patient. As a matter of practice, we do a cholesterol, a HIV test, and a syphilis test on all of our patients. What questions do you have?
Again, it gets back to the CDC's recommendation that this be a standard routine test, part of the healthcare situation. The whole idea is to make it normal and routine, and that people will see it as normal and routine, and then now there are so many different effective protocols that you can have to treat the disease. It's a lot better.
This is just part of what we do on a routine basis here for every patient that comes through the door.
It has to be in an automatic system. The order is already on the order sheet that's used. It doesn't have to be added to an order. It's already ordered on anyone we're drawing blood on.
Where the medical community has had some reservations, that there's still a lot of old notions out there is like, well, what do I do with this patient when I tell them they're positive? In setting up a system of care, back in the late 80s really is when it started, and into the 90s when the Ryan White Care Act was enacted, this set up an entire system of care that did not exist and really doesn't exist for any other disease. And it's very comprehensive because it takes all the social and medical needs and blends it into one complete package, and complete with social workers who help people navigate the system and apply for Social Security and disability and all those various things that are very difficult to maneuver. There are a lot of resources out there, and a lot of them funded by the Ryan White Care Act.
When we talk about HIV, we do a couple things. We focus now on what you do, not who you are. And we also focus on if you have a chronic disease, it's much better to intervene early so that your life and your choices are going to be maximized.
Giving positive results, I think, is just a matter of treating people as we would want to be treated if we were given that kind of news.
Well, talking to a patient, it's basically you have to put it as simple as possible to them to help them understand what it means to have HIV.
And so we spend the time with the clients that they need. We give them the results, give them some time to think about it, and then just let them talk or ask questions or whatever it is that they need to do.
For the client that has established and looking at our providers to be their experts in their health, we're in a great position to be able not only to test, but really more to educate folks too as to what sexual health is about, how to protect themselves, how to protect their partners, and how to have the discussions and disclosure around those folks that do actually test positive.